One, if number of students are less, my spiritual being will be very happy. My soul will be happy because I can interact with each people easy. If it's my business, if I do a business at the level of my core, number of students are less, I'm not happy. So my majority is like I don't actually worry about how many people come. So I'm 80% happy. 20% I don't worry. So what you mean is, you are going to get maximum possible interactions out of the content which I have not exactly prepared, but I just flow. Maybe a little bit of initial scratching of the part of my brain memory I have to do. I have done it already, and most of the things will flow because you will see. So except for Becky, all people are new. Is it?
Yes.
Yesterday's class only one person was.
I joined.
Two were there.
Yeah.
You.
Yesterday I was here.
You
mean the introduction?
Yeah.
I was here.
Yeah, so
You.
No.
no.
Maybe some 10%, 20% I can repeat it. Today's session, integrated Ayurvedic medicine and yoga treatment for office workers. It was kind of a very broad and not very clear introduction for us to give it to people. We were just in an experimentation phase. So I can only say this in a small words is like workplace, wellness, and how I can use yoga and Ayurveda, some part of it, to help me in my workplace. So that's how it's office workers. So we'll start with a little bit of introduction about integrated medicine. All of you are okay with my accent, Indian accent of English, okay? All of you okay? If anything, let us know. Hina is here already.
I'm used to his accent.
So it's a new concept where rather than some yoga teacher talking everything about your body, mind, soul and all the meditation techniques, all about your diseases. So there is a new concept we are trying to do is a doctor who knows about anatomy, physiology of the body, knows about diseases, knows about little bit about yoga. I studied for about 3 years, and little bit about psychology. I'm trying to compile these things and design some effective possible remedies at a different levels. So at the level of physical body, emotional body, intellectual body, vital energy, and all those things that I can be able to repeat. So small introduction is, there is a new field of medicine, we call it as an integrated medicine, which is nothing but also called as complementary and alternative medicine. Which means I will use possible alternative therapies along with or as an add-on with conventional therapies or conventional medicine. Conventional medicine means modern medicine, which I studied the modern medicine, where I see the patient. If I see somebody comes with me for back pain, I'll see the spine, I'll see is there any muscle stiffness, tightness of the muscles, and then I prescribe medicine. Majority of the case, more than 90% of the cases, I prescribe medicine. So that is a conventional medicine. I prescribe medicine to make the muscles loose, relax, so that the stiffness will reduce, the pain will reduce. Integrative medicine means along with prescribing medicines as a doctor, I can also use some alternative therapies like a hot bath, cold compression or ice packs or some postures to change the alignment in a such a way that I can reduce the impact of the malaligned or not aligned posture of the body, so that I can prevent muscles going into shrinkage or spasm or twisting. So I am talking at one aspect where it is related to you. Integrative medicine means taking those different aspects of things, trying to give it in an evidence-based way. As much as possible evidence I collect and give it to you in the form of evidence-based way. So this is also called as CAM. Very Western aspect. Western people are very used to it. CAM. So
Scam?
CAM.
CAM.
Yeah, complementary
Initial.
CAM. Complementary and alternative medicine. So throughout the world, we consider America as the highest authority in everything. Every material things. So National Institute of Health, America. Oh, thank you for reminding. National Institute of Health, America. Are you able to follow me? Are you able to follow my words? Okay. National Institute of Health is a government body of America which says that 70% of all people visiting a physician, first time I go to a doctor, 70% of the problems are related to stress. So this is a valid statistics, says that 70% of all the people who are going to a doctor for the first time, their problems are related to stress in one or other way. You're able to follow me?
Yeah.
So for example, back pain, sleeplessness, anxiety, headache. These are very few diseases which are very commonly seen in a medical practice. It's like acidity, constipation, easy fatigability. I get tired very fast. So these few symptoms are very common. Most of them can be tackled by the stress. But most of them are induced by the stress and tackled by removing the stress. So it means, in other way saying, if I divide diseases into non-infectious diseases and infectious diseases, the statistics means more of the diseases are not infectious because of cold I am getting with some virus is affecting my nose system and I am getting cough and cold. No. More than 70% of cases are related to non-infectious diseases. NIDs, we call NID. Non-infectious diseases.
Stress is also infectious.
Yeah, no, it's non-infectious.
If you are stressed,
Because of
I'm also
stress.
stressed.
Yes, because of the stress, the immunity can go down, then it can become infectious, very prone for, susceptible for infection, yes, because your immunity goes down. It means that somewhere, the preventive medicine, the integrative medicine or curative medicine has to work in the direction to prevent disease even before it comes. Somebody having back pain, come to me, I'll give therapies. Okay, no problem. But how long? Till the sitting posture is corrected, till the habits are corrected, still the strength of the muscle is built up. I keep on giving medicines, it's of no use. So because of that particular idea, I was trying to work more for the preventive medicine. I want to prevent a disease. Doctor, we don't need much of the doctors. Already there are existing doctors. There are tremendous, terrible specialists are available. Even for eyelashes there is a different doctor. For lens there is a different doctor. For retina there is a different doctor. Just for the eye specialty. Only this person only works for retina. This person only works for some of the parts of the eye. So that much of specialty, we are forgetting the person as a whole. As a holistically, we are forgetting the person. And forget about mind, emotions. We never ask. Most of the doctors don't ask. If you come to me and say, what's happening? If a super specialist, any one of you visited any doctor recently? 6 months before, 8 months before, 1 year before? If not, well and good. If yes, any specialist will not be able to give you more than 15 minutes. Because he will be having 30 to 40 patients waiting in the list, and he says, what's happening? I went to different Chinese modern medical doctors also. They will be sitting so much exhausted, stressed that, what's happening? Back pain? Where? Since when? They themselves are stressed. Since when? 15 days. Okay, any other problems? Neck pain? Are you able to move around? Sit down? No? And they'll see it, and then say either they'll send it to you, X-ray or some blood tests. So we are working more for the finding out the cause. What is the cause of the problem? But problem, statistics says cause is somewhere not there. We cannot find it. If I am looking at the computer screen too much, too often, I may get my eyes burning sensation. If I check my eyes, no problem. If I check my vision, no problem. Why your eyes are burning? Simple. Your blinking rate is reduced. You are not able to blink so much which you used to blink because there is a screen, computer screen or mobile screen in front of you. So these simple things, doctors are aware, but still we go for conventional therapies. Okay, eye problem, check your eyes. More diseases are here. More than top 10 killers of all the diseases are non-infectious. Top 10 killers like a stroke, heart attack, diabetes. So more of the non-infectious diseases are more. So we need more of the integration of things to counteract and to work on this. So that is a little bit introduction about integrated medicine, where we add on different therapies. Let it be Ayurveda, let it be traditional Chinese medicine, let it be acupuncture, let it be massage therapy, let it be a herbal therapy, let it be a antioxidant tea therapy, whatever it is. So everything constitutes within this particular big banner of complementary alternative medicine and integrative medicine. I especially practice this, especially for the nervous system disorder, for stroke, for epilepsy, for anxiety, for depression, for other insomnia related things, headache. I practice of this more often to combine integrative therapies for stroke, people with a stroke to recover from stroke rehabilitation. So in your case, what is the use of all this knowledge? Are you able to follow me?
Yeah.
Is okay, now I will go in your details that your life and work and leisure activities or hobby activities or activities. How much, if I draw a circle like this, how much you are spending, like family, I put your family, life again divided into family, I want to sleep also. There are so many other factors. Main factors are work, your personal life, and other leisurely activities. How much time you spend for all these things? We make a small circle. Before that, I think we should introduce yourself to me and myself to you, so that we share our problems, and we are very few people, so that there is already correction or checking of the alignment of things can be done now, right now. I'm a simple medical doctor. I completed my MBBS, we call modern medicine, followed by MD in yoga and rehabilitation, and MSc in applied psychology. So I use medicine knowledge of anatomy, physiology and disease. I use yoga knowledge for Eastern psychology, and I use my clinical psychology knowledge from the Western psychology to combine and help at the level of mind, body and spirit in an as much evidence-based way as possible. So that's how I'm trying to explore this medical yoga concept. So I'm sure it will be helpful for you. I would like to know your name, your background, how many hours you're working, and what you're expecting from this particular workshop.
You said
You're thinking where to start?
My name is my Chinese or yeah. And actually at noon, yeah, we have the break time, but I can't do anything else, right? So it's 15 hours.
So I'll take out of this. Sleep I'll finish. See if I forget. How much you're able to give your family time? So if you wish to share your, if you're not married, how much time you're spending with your parents and brothers and sisters? Married, how much time you spend with the family?
At present, I think just 1 hour. Yeah, 1 hour.
See, what is important for us? We work for the family. We work for the family.
Yeah,
How much time we give for the family?
I know.
So, just one ask, how many hours you watch TV?
Watch TV?
No.
I don't watch TV.
Never.
I do some major things. I mean, I have some hobbies.
Half an hour, 1 hour, 2 hours.
2 hours.
Every day?
Yeah, as much as I can do.
Every day 2 hours means you're luckiest person.
That's it.
So you're happy with your work life?
Not really.
No. I say this side is,
That's why I come here actually.
if you listen to my advices, you'll run away from here. So I left all the jobs, I stopped all the jobs because I was thinking what use I'm doing ultimately. I'm going and earning and coming back and spending. Not able to spend much time with the family and just giving money.
But I just wonder because most people do yoga, they don't have a job, they don't have a daytime job. So, how do you guys survive?
I survive in a very minimal. I do work. I work as a consultant.
Yeah.
Consultant, I go there not with their time, their demand. I go with my time, my patient, 1 or 2, 3 or 10 patients I see and then come back. That will give me some livelihood. I earn somewhere around 800 yuan to 1200 yuan per month. That's why I come here. So we are more or less fine. So if I say work and life, you're okay. When the workload here on work side, you are spending more time, still you're okay. Any pain, back pain, neck pain, anything?
Yeah, I think my shoulders, here, and with back.
Lower back pain.
Yeah, lower back. Yeah, lower back. And legs.
How many hours of computer work?
Huh?
How many hours of computer?
Most, yeah.
Not much.
Yeah. Just my work hour.
Is computer work?
Completely, yeah.
what on the computer?
And when I'm busy, I cannot, stand up or go anything.
Okay. Do you get burning sensation of eyes? Burning of eyes?
Yes. My
Like this you feel?
the ability is not good, I think. But I don't wear the glasses, but it's not good.
So you are able to refine and define what problems we are facing which are non-infectious. Not infection, but still there is something not okay. Tell about you.
I'm Nicole. I'm from Malaysia.
Which part of
And
Malaysia?
Which part? Ipoh? Okay. So I'm a yoga teacher. So I'm mostly my time is in leisure.
Your time is like this.
Okay.
So family,
No,
Leisure.
I'm yeah. I'm away from my family, so I'm
Yeah.
yeah.
work is leisure, teaching yoga.
Work,
Travel?
leisure. Travel a lot of time.
So this is one of the most dream come true. Where I travel, leisurely, teach leisurely, come back home leisurely. So all the time is your
It's
leisurely
leisure.
time. So it's dedicated for. So this is what I was planning and I was trying to do it. So this is what I'm saying. So yoga
It's like
teacher.
no pain. No pain.
So how many hours of yoga practice per day?
1 hour.
One.
One
Teach.
Teach
What
3
exactly you
hours.
teach? 3 hours you teach. You practice for yourself 1 hour and you teach 3 hours, 4 hours. Already
Yeah.
physical exercises you are already doing.
Yeah.
So no emotional issues, getting angry, not able to sleep,
No.
not much at the physical levels, not much problems.
No.
Well and good.
I think we should all become yoga teachers.
Yes.
I'm Becky, and I'm working in the school as a principal. Okay, and so I work from 7 to 6 or 7, so it's almost 12 hours.
12 hours?
12,
12, okay.
Monday to Friday. But I got winter break and summer break, which is great. So here is my winter break. So completely relaxed and reading and do yoga.
So let's say you're able to come for all the classes.
Hmm?
Let's say
Yeah, that's why I can come. Yeah.
Lucky winter.
Yeah, so I love this job. It's the job, I enjoy my work because I love the children and I love my teachers. So at work, I have stress is the schedule, but with the people, of course, sometimes I need to communicate with people who are not communicating with me. Okay, so that's my main frustration. But otherwise, I enjoy my work. So that's why I can stay 12 hours.
So
Yeah.
you have made your work as a passion. You're passionate about your work, so you'll not feel tired.
No.
How's your sleep? How's your mind, emotion,
Yeah,
energy levels?
I'm over worried, so I do not get good sleep. Usually I have a lot of dreams. And whatever I think in the daytime, I dream the solution in the night. And that's why I get up tired, but I still have to work. So it's a kind of vicious circle for me in terms of sleeping quality. Yeah.
See, remember 2 minutes before I said non-infectious diseases, infectious diseases. Non-infectious. There is no infection which has caused this, but the lifestyle has caused this. So it's not infectious, but still it's affecting, as similar to infectious diseases. As you said, vicious cycle. So somewhere we have to break. That break.
I do have the weekend and the evening to do some yoga.
Yeah.
Okay, so and my husband does it with me. It's a good common habit together as a couple.
It's one good stress buster. Your life partner is also giving you a cushion or stress absorbent, and it's a mutually helping each other. Well and good.
Namaste everyone, my name is Vikambra. I live in Shanghai and I'm teaching yoga in the companies, so I'm here for them.
So,
Yeah, I love my job actually. So it's the same situation with like, so I'm happy with my life now.
No much complaints.
not much good
Body,
morning.
mind, soul, mind.
Yeah, every day I spend a lot of time chanting mantra
Which
because
mantra?
I follow the Buddhist way.
Om Mani Padme Hum.
And like this. And practice yoga at home and with my teachers. Yeah. So I'm happy to
Happy with your work.
teaching. Yeah. With my work, with my learning, so everything is good.
Anish. बता अपने बारे में बताओ छोटा सा.
Namaste everybody, I am Hanish coming from India and I am teaching here. So I am just thinking that I am not working here. I am just sharing my knowledge to everybody. I am serving to the society, serving to the humans. So I am happy.
No problem. I'm very similar to her. Very long working hours. My day job is sometimes 16 hours, sometimes 8 hours, because it depends on project deadlines, and sometimes I can work on weekend also. I spend 1 hour on average to do yoga every morning.
In spite of this time.
Yeah, that's what gets me going. 1 hour for family. Commutes, today commutes, I think 45 minutes one way, so 1.5 hours both way. But I also travel internationally for work also. So on average, I probably travel quite a lot, wasting a lot of time on the road.
Okay. So at the background of your mind, you are designing already how I can use this my working time to do some help for myself at my body, mind and soul. Just by listening to this, you should be able to design something at the back of your mind.
Hello, I'm Jeanette from Philippines. So it's my first time here in yoga. Today I would like to thank Sir Garnish. He asked me to come over here to learn a little bit of yoga. I think I work more than all of you because I have 2 works. So one mostly in a restaurant and then in the morning in company. So I'm very lucky if I have 8 hours sleep. So mostly it's like 4 or 6. And most of my time is only to work. Work home.
16, 18, 20 hours.
Probably maybe let's say if 4 hours it means 20 hours at work. Or 16 to 20.
So work in this work definition, you also include the commuting time also.
Yes.
If you include commuting times, you say 20. Did you say 20 hours?
Yeah, sometimes.
20 hours, 4 hours sleeping. Then where are the rest of things? Tell me about time today.
No, work, it was actually work. She came here for work. She came here for work. I just pulled her inside. I told her to come inside.
Okay. So any problems at mind?
Yeah, actually lower back pain, here, and sometimes also the same, like sometimes you're sleeping but it's like you're working also. It's like your mind is working.
Mind is thinking too much.
Yes.
So are you able to define the problems at the back of your mind already? Yes. We saw even in this smallest of group, statistically, more people are complaining of low back ache. So we will see why.
Yeah, I've pretty much worked towards that now.
This one?
No, the bottom one. The bottom one, yeah. No,
The circles.
The circles.
Cool.
Yeah. I was up there before,
Yeah.
and now I'm down there. I actually work at an integrative medicine clinic where we
Very
practice function.
Yes.
Ensemble number 12, where we practice functional medicine, naturopathic, and TCM.
Super.
So I handle all the events marketing. But I'm a consultant, I'm not full-time, so I'm pretty free. I can go there when I need to for meetings.
You are like workplace consultant or integrated consultant? or a
More
doctor
events
consultant?
planning.
Event planning.
Event planning for the
So
clinic.
events, doctors, patients together, some events.
I organize events to promote our services, but it's more towards promoting wellness.
Okay.
Yeah, where we combine some medical aspects and healthy living, healthy eating, Yeah, and also collaboration with different partners. Yeah.
In short, you'll say,
So I've definitely like worked from up there to down there now.
yes,
Sorry?
lifestyle modification programs.
Yes, yes. I did a career shift. I used to be in fashion luxury sector for 17 years. And it was a lot of hours and a lot of travels and blah blah blah. And then I'm
Blah
like,
blah blah is the life itself.
yeah.
Very good to know you. So,
Likewise.
next is
My name is Lakshmi Arati. Before it was freely my India, I come Shanghai after more happy, more friends and more activities, and my life is changed. I'm more happy. Any problem, I adjust.
Very good attitude.
Yes.
adjust. We use this word adjust throughout.
Hi, my name is Ganesh. I'm also from India. I'm in Shanghai for quite a long time. So when it comes to work, I take it as all the work. Like throughout my 24 hours, I'm working. I'm also in Malaysia. I'm also traveling. But health issues are there because I'm just lazy a little bit. Other than that, I think.
You look lazy because your mind is working too much, body
Working too
cannot
much.
cope up with that.
Yes, and I feel it's quite okay at this point of time. I take it because I do it because I want to do it. So there's some passion behind it. There's some goal behind it. I think I'm pushing too much towards it. So I find it entertaining myself. So the entertainment part is also 24 hours. Yes, I do have planning whenever there's a designing of a place and designing of a product or something. Even in my sleep, I do design it. I do design it. So but those experiences are something with awareness. Like I'm being aware of those experiences. And I find it, yes, tiring in the morning, yes, I feel like if I have to take a class in the afternoon, probably yes, I will not be performing well. So if I can modify the place, modify the daytime that I don't take a class, but still I can send the teachers or do something like that. So I'm still prepared. Like I'm trying to work on all the aspects so that during the non-attentive or lethargic stage during the daytime.
It's the first time I heard him. So I want him to get succeed for just yoga because he is trying to do it as authentic, as traditional as possible. So not just branding. Branding is just there to show it, but he's trying to work so much. So I love to work with you also. So already in this also we are doing a business deal here. So it's interesting. I see now after understanding this group of people, I know that this is not just a simple people who are having some back pain. I can teach you some back pain exercises and go home. No. Actually, for some 1, 2, 3, I need 4, 5, 6. I need to teach something where they can take home and they can do it for others. They'll be able to evaluate alignment. They'll be able to do something for themselves. It's a little extra knowledge where they can take it and adopt it in their routine yoga programs or in your integrative medicine where you can take up something. But for me to build this plan, I took a lot of references from different schools, different doctors, different people I went and met, and I think collectively it will be useful for you. Maybe tomorrow I'll be, or after the break, we'll do some evaluations at the physical level, mind level, and I'll tell you how to do it non-professional way also. Simply, I'm a doctor and I do it, it looks nice, but if a yoga teacher tries to do this alignment, they should be able to do it well. So I have a simple tools to do it, which I'll tell you now. It's nice to know you.
Doctor, tell something about you.
I'm a madman. After my MBBS studies, I was starting a clinic. When in clinic, everybody wants to ask me that, okay sir, I'm having this problem and give me a quick fix. I want to take tablets, I want to take injections, I don't mind. I don't want to do exercise. This is a common tendency. I don't have time. This is the most common tendency we have. Are you able to give time? So no time, no time. So disease also says, I don't have time, let me stay with you, I don't want to do, I have enough time. Disease will say, I have enough time. So I used to say that, am I doing justice in my medical career? I'm just treating the symptoms. And I know the cause is somewhere else and I need to touch that cause at least. And even to spend with the time with the patient, I need to know the patient fully, unless if I ask somebody, you're having acidity problem, I'll give you anti-acid to counteract the increased hydrofluoric acid in the stomach. Unless and until I know the mind of a person, what he or she is undergoing at the subconscious level or conscious level, what trauma she or he is undergoing, I'm not able to remove the cause, but I'm just treating the symptoms. I was not very happy. So then I left my clinic practice and then started my MD in yoga and rehabilitation. It is totally different field, going to a modern medicine. And next was my next super specialty. I turned back, going back to MD in yoga and rehabilitation from the same school. 1, 2, 3, 4, all from the same school. I did my MD in yoga and rehabilitation. He did MSc, he did MSc, Amma did other course, PG diploma in yoga, and MSc also she did. So this was a life-changing thing where I used to say, what I have in my India to give back to the West, everything I will just follow British medical system. What I have, an Indian origin, to give it back. Every time answer used to be yoga, Ayurveda and spiritual aspects, which I can give it back. And I was thinking, I am lucky enough to know the body myself, being a doctor. I am lucky enough to know the disease, lucky enough to understand the mind. If I work a little bit, I can able to understand the mind. So why can't I use this therapy with some evidence base? So that was a beginning point of integrated medicine in my particular individual life, where I can give it back. So this is how I try to build it out and work out. You will not bug your mind too much. Workplace wellness is the biggest industry where this information for yoga, statistical information, more than 80% of earning of yoga comes from workplace wellness programs, stress management programs, or as an individual person, if you have a yoga studio and earning, that's a different aspect. People are coming to you and you are going. So more money revenue can be generated by workplace wellness program, by yoga and other integrated activities. So I wish those yoga teachers who are here can integrate other things also in their routine career and use it for better, refined, sharp quality services to other people. So this is how statistics works. And when I say complementary and alternative medicine, top 10 complementary and alternative medicine, first one is acupuncture, acupressure, and other traditional therapies. Second, third, I don't remember, and don't know. Fourth one is yoga. Second, I think it's a massage therapies. Third or fourth one is yoga, and the sixth one is Ayurveda. So statistically, top 10 complementary alternative medicine, definitely your indigenous traditional Chinese medicine, acupuncture was foremost because it was most proven, efficient, evidence-based alternative therapies available for the medical community to give it back to the people. That's how acupuncture comes first. So yoga somewhere 4 or Ayurveda. So top 10 modalities of alternative therapies are yoga and Ayurveda for me. This is a statistical information. Other 10 you can just take it on. Needle therapy, moxie and other therapies. Indigenous Reiki healing, pranic healing, prayers. Prayer is also top 10 therapy. I cannot do anything, just I can pray. So those are all top 10 complementary and alternative services. For me to give it to others, I need to know it for myself. So as I given a statement, 70% of primary physicians visits are related to stress. So I need to know about it a bit. So in our body there are two types of nervous systems. One is at the level of center, we call central nervous system, brain and spinal cord. Brain and spinal cord. It's called a central nervous system, and call it a CNS. And nerves attached to it, the peripheral nervous system. It will not be this crossed, it will be super refined peripheral nervous system. You're okay with this? If I ask you to raise your right hand, can you raise all of it? Raise your right hand. Up your hands back. So my voice travelled in the medium of air and it has reached your voice, and your ears have sent a signal to the brain that something you have comprehended with your brain, and then you send a signal to your arm that raise the arm up. So that is under your control. It is voluntary. Yes? It is under your control. If I ask you to control your heartbeat, stop your heartbeat for 10 seconds. Can you stop? No.
Maybe
So-
you can do that.
It'll become a yogi. Yeah.
Some yogic people can do. So that is that can be called as an. I'll come to that point. The peripheral nervous system, it's divided again into voluntary and involuntary. Involuntary nervous system is again divided into two. Sympathetic, parasympathetic. See, in this, each information is very important, maybe from my standpoint of view, so that you can design the protocol by yourself. It is like giving you techniques to catch a fish, not just selling you a fish. So which one is better for you? If for office workers, if I teach you some 20 stretches, some 10 breathing techniques, or some 2 breathing techniques, 2 meditation techniques, and wind up the class, will it be good for you, or you want to know why you have to do this?
Let me just translate this bit. People are checking. 就这个老师说的是中枢神经和周围神经，然后周围神经这边分出来了有这个自主神经和非自主神经。这个 involuntary 是自主神经这一块又分成了两个，一个是交感神经，一个是副感神经，然后就会主要教这两个交感和副感神经。这个就会等一下他会教你跟这个相关的训练，然后就会帮助你怎么样来把这个 stress 还有其他东西减少，控制我们不能控制的那些东西，通过这些练习。
Sorry, so CNS is involuntary.
那个是中枢神经，
Okay.
中枢神经。然后 PNS 是
Central nervous system.
周围神经，周围神经下面又出来
Central
了
nervous
这
system
个。
is both involuntary and voluntary. For example, I am walking and suddenly a needle is pricked. Signal goes to my spine cord without even before registering I withdraw my leg. So it is an involuntary reflex.
Right.
And same I use my brain to walk and do the voluntary activity. Central nervous system is controlling everything. So it is both involuntary and voluntary.
Both. Okay. And the other one is
It's a peripheral nervous system.
para
Peripheral,
or peripheral.
peripheral
周
nervous
围
system.
神经。
Okay.
心脏那个是另外一个，心脏那个是肌肉，那个是就是平滑肌、骨骼肌和最后这个心肌。
I'll give you an example. A deer is running for its life from a tiger. What will be the state of a deer or a zebra in the middle of the fast? Snake or python? What will be your response? Will it be quite like this?
Gonna run.
Jump.
Gonna run very fast.
Run away. Run. Somebody strong like Ganesh, catch the snake and kill it. Fight. So you do it. Screaming, yes, alert. Screaming, yes. Any other things?
Friendship. Friendship.
Friendship.
Snake, if you put the snakes, if you want to make a friend of it or you want to catch them,
Too evolved.
Not be friendship with your supplement.
Friendship with the
oh, no, if I am a snake
Catcher.
like hunter, it's a boon for me, right?
But still it is a fight.
Yes.
You're using your skills there to fight with an animal. So your nervous system is designed to protect this biomachine. Body as a machine. Your body is a machine. I consider body as a machine. Your nervous system is designed to protect this nervous system, this entire body, preserve it. So for this, body is working in these two systems. One first system where I feel alert, I feel my muscles are become very tight. I want to fight or I want to run away. So it's called as fight or flight reflex. Or one more you can add fright. Fright, F-R-I-G. Fear. Reflex. What happens here? In animal, it is a survival response. If animal do not run away from the tiger, if a deer do not run away from the tiger, it will be dead. It will be dead. Yes? It is a survival response in any animal. But we are not having the survival problem. We can kill the snake and eat. So we don't have exactly survival problems, but the nervous system is designed in the same way to protect you. Any stress it takes at the level of physical body or at the level of mind, your body, your nervous system responds in the same way as that of a deer running for its life from a tiger. So, any stress here, you're okay with this? Any stress here, it can be anything. Your emotional issues, triggering is a stressor and it is triggering kidney. On the kidney there is a small gland called as adrenal glands, which is 10 centimeters by 6 centimeters by 3 centimeters size, which releases hormones called as stress hormones. Stress hormones, mainly adrenaline, noradrenaline. All the response of the body will happen because of stimulation of involuntary nervous system, especially sympathetic nervous system, wherein alertness has been created, and this alertness signal goes to the kidney, and on the top of the kidney there are some glands called as adrenal glands. Adrenal glands will secrete stress hormones. Is it becoming too much technical? But is it a new information for you? All of you? All of you is a new information or it's?
听说过是吧？肾上腺素听说过，
对，在紧张的时候会肾脏会肾上腺素会跑。
Just the term we don't know, but yeah, we heard of it.
Yeah. We know the concept, but we just have to put the word with our own concept.
Okay. If you are able to follow it. Or if it is too much technical, I will cut down. Okay. It is a beautiful way where I connect with this to a disease. At least 5 of the disease I can connect and show that, as I have given a statistical information, 70% of diseases are due to stress. So I am trying to talk about stress and then correlate with back pain or neck pain or constipation, alertness, not able to sleep, just correlation. And after that we start about alignment of the body and other processes.
Teacher, I have a question. If, let's say, can I say like this? If the person who have a lot of stress, probably they have weak kidneys.
Weak kidneys means it is working too much, so it's becoming weak.
Okay.
So you're
Can you explain like this?
you can explain based on the traditional Chinese medicine concept. We are talking in that preview.
Oh, no.
Then
I just make
Casual.
a link, like, yeah. If a person have a really stressful life, they will have weak kidneys. Is it correct?
no.
No.
Maybe it will make the kidney very
Weaker.
strong because it keeps working, it keeps functioning.
One way is this, yes. Not exactly kidneys. I'm not talking about kidneys. On the top of the kidneys,
On the top.
there is an extra another gland.
Ah, okay.
Not exactly kidneys. Kidneys won't work. The situation of this gland is on the kidneys, so I have to show the kidneys.
So is it making the glands weaker?
Yes,
Ah.
depends on how much amount of stress.
Oh.
You're catching the right. I want this question to rise. See, if I want to define a stress, stress is equal to more pressure and less resource. Can it be acceptable? I have more pressure and less resources to handle the stress. If the pressure is becoming too much, at one particular point, this adrenaline is working and it is trying to balance, it's okay. Yeah? At one point of time, the pressure is so much high that your resources are getting exhausted. So it's becoming weak. You're also right, you're also right. Initial phase of the stress, it is working too much, so it is strong at that time. After some time, it will go into a phase of exhaustion and exhaustion. Then it will become weak. You got the correlate?
Is there a difference between men and women? How much adrenaline?
Same.
The same.
What happens if the adrenals are exhausted?
Body goes into a phase of exhaustion.
Exhaustion. Oh, that's when you break down, is it?
Yeah.
Nervous breakdown?
Or you can call it as, in a common term, you can call it as a burnout. So for any wellness activities, this information is absolutely vital. You are into which phase of burnout? 1, 2, 3. So this information makes you design your own techniques. So this is very basic. I hope you are okay with this. So any stressors, I can put it here. So modern or thinking animal, a human being, do not have survival problems. There will not be a tiger chasing me all the time. There will not be snake wants to bite me all the time, unless I'm in Amazon jungle or something. But I have different problems, but system is same. The same amount of hormones responsible for the deer to run for its life are secreted when I'm sitting in a traffic, waiting for my time to come. Same amount, same hormones, same process. There it is used for survival, here it is used for nothing. So it's a more of logical, emotional, psychological, inducing the stress hormones to be released more. So if you know this, you can work on this and you can control it. That's how it's all the process. For every workshop, if you say this is for me, it's a common. This is the foundational level of uses. You're okay with this? Till this? So any stressors, simple traffic jam, workload, emotional problems, financial worries, relationship worries, health related issues, anything can trigger my stress response of my body. My adrenal glands will start secreting too much of stress hormones. These two names of it, just remember names. Or even if you don't remember, just remember stress hormones. So adrenaline, noradrenaline. Till this okay? Till this okay. What happens? My alertness increases. My muscle tension increases because either I have to run or I have to fight. My muscles has to work more. Muscles has to work more, muscles will contract more. Muscles contract more, it needs more blood supply. What heart has to do? Heart has to pump more. So your heartbeat is more. I'll say increased heart rate. HR is a heart rate. Increased blood pressure. Let me write it. Increased heart rate. Heart rate means number of heartbeat per minute is called as heart rate. An average is around 72 per minute. When you are anxious, it will increase 110, 120. So I will be checking your pulse rate when you are sitting quiet. Now you are relaxed. So I will be checking the pulse rate and I will be telling you. I will tell you how to check also. Increased heart rate, increased blood pressure, increased respiratory rate. My breathing has to increase. Why? I want more oxygen to my muscles to work, either to fight or to run away. You with me? My alertness increases. Okay. These are very basic things. Here, my body wants to work in a different way. What it wants to do? It wants to take more blood towards the skeletal muscles. Skeletal muscles, more blood. We have 3 sets of muscles: skeletal, heart, and smooth muscles. So less blood supply to digestive system, because when you are stressed, you don't need to digest. See, these few more and less is digestive system, endocrine system. This you have to translate. Endocrine system and reproductive system.
消化系统，第二个是什么系统？
All
腺体。
腺体，然后第三个是生殖系统。
Stress in itself is a very huge topic. You can write volumes and volumes of the book, and you can correlate with each system, endocrine system, how it is affecting the eye, how it is affecting the stomach, and all those, how it is affecting the skin, age, everything you can correlate. Till this point, okay?
内分泌系统。
Say for example, the deer or a zebra or whatever is the animal ran away from the tiger and it is saved. Does it feel the same heartbeat or it feels relaxed?
Tiger.
Can you repeat?
It's not going to be relaxed.
If an animal who is running for its survival, it escapes the death by the bite of the tiger and it escapes, not relaxed. Now, will the animal's heartbeat will be the same, or heartbeat will be, blood pressure will be the same, or muscles will be same tight, or it will get relaxed?
It will be same. After few minutes it will be there.
Now, if it is totally, you are totally saved from any stress. Tiger is gone, so you have more distance from away from tiger. Now it will be relaxed. For this relaxation,
Parasympathetic
nervous system we call parasympathetic nervous system. In short, this is to make you fight or flight or getting stressed. This will make you rest and digest. So Chinese people already have a good concept. After afternoon lunch, they relax, they sleep. So they are already stimulating parasympathetic nervous system. They are resting after sleep. So digestive juice will be more, digestive blood supply will be more, and they are resting. They are not triggering the sympathetic activity. They don't want. So already good. Already. This is a part of Ayurveda system you are already following. So good about it. That's why the death rate or average lifespan, WHO World Health Organization tells about average lifespan of a Chinese is 83. If I compare 1,000 people, at what age they die? So average age is 83. Indian average age is 69. Latest information I don't know. I'm very sure that it's 69. Average lifespan of British people is around, I think it's 2. Average lifespan of Americans, I think it is more. It is 6 plus. So there is a difference in the people who live for long. So we calculate lifespan. This is about it. Is it too much bugging information, or it's okay?
Why do you want to bring in the average age
Average,
from different countries? Well, especially
especially in China, what my studies says, I am working on cancer also. What my information says is, Chinese diet, especially vegetarian diet of a Chinese, and the system they follow. They eat very early, 7, 8 a.m. Before 8 a.m. they eat. Afternoon lunch will be around 12 to 1. Afternoon, evening before sunset, they eat. So you are preserving, you are somewhere there is a flow, you are flowing your natural rhythm of the body in the flow of the nature.
It is also written in the Ayurveda.
It's exactly written in the
It's in
Ayurveda. That's
Ayurveda.
what we are going to say.
yeah, it's just that we how Indian people eat and rest, and so I was surprised to see it's quite low. Whereas
somewhere I correlate with the same, because Indian, we're into an evolving population where our workload is so high that mostly I think even for taking 15 minutes rest it will be difficult if you are working in a corporate. If you are working in a government setup, I think most of the time is a rest. Indian little working style is a little different. Some people like Ganesh or me, corporate sector, not working for ourselves, will be working too much. They have test. Afternoon, do you sleep usually? Usually, according to Ayurveda or according to this concept, if you follow, we should afternoon nap. One more research comes in the same direction. Afternoon nap increases work productivity in the rest of the day. Can you see this? Can you be able to correlate this sentence? Afternoon nap. Nap is a short, maybe 20 minutes to half an hour to 1 hour. Increases productivity rest of the day. See, if you sleep around 2:30, you wake up. So rest of the day will be more productive. So it means you are able to design a technique where after lunch you are not going to give them any exercise. Give them a relaxation, short relaxation. Yoga Nidra, design a relaxation technique. I can teach you in these 2 days. So you choose the time. If you choose the time, you should have some background information to give them what you want to tell, why I have to rest in the afternoon. See that? The sympathetic nervous system is exhausting. Throughout the day we are using it. And the parasympathetic nervous system has to rest more. All of your wellness programs, all the yoga activities, everything in this world you want to do is increase the parasympathetic nervous system's activity, reduce the sympathetic activity. Most of modern lifestyle related diseases are because of too much of this.
So if we decrease the sympathetic things, so you mean we can increase our lifespan?
Not exactly directly related. It is a geographical area, your diet, your activities. There are so many other factors also contributing, your exercise pattern. Indian genes also, we have a more tendency to have a abdominal fat. It is not we are lazy that we are not able to do. It is our genetic makeup is like this. We have a genes of a polar bear, kind of, where we try to store more. We have a gene tendency we call FF. If you check a genetic analysis, most of Chinese people look slim, trim, good, because genetic makeup is like that. So there is a lot of famine or drought happened in India long time before. The body type has changed. That's why rice eating habit is more, wheat eating habit is more in Indian continent rather than Chinese continent. If I see amount of bowl of rice, Indian Chinese people eat this much of rice and this much of beef, some piece of beef, some piece of pork, part of vegetables like this. So content of the food is different based on the geographical areas. So in your questions, not exactly directly related. Yes, of course, by working on this, definitely the quality of life increases, the lifespan increases for sure. But it's not the only one factor. Other factors are also important.
I'm just thinking want to increase my lifespan. Maybe follow the natural body cycle, like eating at a good time and rest at a good time. Maybe the lifespan will a little bit longer.
Yes,
right?
for sure. But if our environment, we are blowing the environment like anything, and we are in the environment where it's absolutely polluted, the lifespan definitely is going to decrease. So it is not just me, my family, my community, then my stress level, sympathetic activities will be less. With me, my community, my family, my all surrounding people, plus environment. So it's not just me. That's how our all focus is me, myself, self. So then for your health it should go non-self. So it's a very big concept. can speak hours together, but
I have a
just focus.
question.
Yes.
And because you just say in the Ayurveda way and in the noon you need to have a nap. It's good for lifestyle, something like that. So I ask question because I teach in the company. They have class in the noon or after their job. Lunchtime before or after maybe 6 hours. I have classes. So for Ayurveda aspects, what kind of classes will be good for their noon class and afternoon class?
What
How
kind
to
of class you
design,
teach
yeah.
usually?
Hmm?
What kind of classes? Yoga classes?
Yeah, yoga classes.
Yoga classes, you can, afternoon classes, simple breathing techniques, simple
Oh.
nidras are good, simple relaxation techniques, yoga nidras are good, where sympathetic, parasympathetic activity will be more.
Oh, okay.
And even if you do asanas, it
Yes.
should not be too much of dynamic one. So it's very simple step, simple
Simple strap, okay.
movement, you know.
But they will just tell her not to come anymore.
I guess so, yeah. Because
But you need to
people-
find, what you could do is you can actually design a little bit of meditation technique after those stretches. Because you will have to go there.
Yeah,
So
of
with that you
course.
can just give some meditation technique.
Okay, for the noon class, maybe the yoga nidra way or some in yoga way is good for their lifestyle, I guess. Okay, thank you.
So I'm happy that, see, this is how we are buffering the questions, because based on this, if not I'll say, okay, for the back pain, so this is alignment, check the alignment like this, you have to straight shoulders, and there are 2 points here, 2 points here, 2 points here, and at the center there is a center of gravity. Balance this and give some exercise. I'm giving you the product, but I'm not telling you why. So this will make you design your own. See, now you are thinking in your line. You're thinking in your line. For my patients, for my clients, what I should use based on this knowledge. You know, you're okay with this till this now. Modern lifestyle, more of sympathetic activities causing disease, less of parasympathetic activities. If somebody is very simple, relaxing, not doing much activities, we'll say it's a very lazy fellow, not doing anything. We appreciate multitasking people, we don't appreciate relaxing. So that's how our world is built. Our system is like this. Our system wants this to function more. Correct? All the system, all the corporate work, everything is more sympathetic, more multitasking, more work. So with this, I'll try to correlate. If it is a short term, maybe few moments to few hours to few days to few months, your parasympathetic nervous system is balanced enough to balance this up and down. No problem. For few months, no problem. Till the stress, I put the stress like this. Stress is equal to more pressure, less resources. S is more P, more R. Till your body resources are there to support, I will say like this. So this is your body resources, this is your stress. This much of stress, body resources will manage, no problem. This much of stress, the body resources manage, no problem. This much of stress, even if it is there, even though your body resources are exhausted, no problem. If you give a time to recover. So we are not giving time to recover, so it is working too much. Now, to correlate a disease, I will be very alert, too much of thinking. Number of thoughts are more in my mind. So I may end up in insomnia. More alertness, emotional tendencies, anxiety, depression. So these are few examples of mind-body related problems. 70% I already said it is stress. Stress can induce anxiety. You are already feeling anxiety. I will give you a tool maybe tomorrow as a questionnaire. It's called as hospital anxiety depression scale. In your things, I think we will try to make it in Chinese version also. Just give it to the client. They will write 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. 14 questions will make you understand how much anxious the person is, how much depressed the person is. It's so easy. We don't need a psychologist. We just need a simple paper and the scoring system. It's easy. In your working place principle, check your anxiety status, depression status of your teachers. Check the anxiety status, depression status of your children. How many children? If somebody is very anxious, focus more on those children. If somebody is very depressed, focus more on those children. Children have a more suicidal tendencies if the work pressure is more. So you can focus. To focus, I cannot hire one or two or 10 psychologists and ask them to check everybody's psychological score. It's not possible. Not possible at all. Even if I want to do. But here, I'll give you a scoring. You do it. If somebody is anxious, bring it to me. Bring them to me. Bring them to just yoga. 10 yoga teachers, 10 yoga teachers. Somebody is anxious. You can work on. So, you know that stress is more, pressure is more, and you yourself can do. So, I'm seeing people who can contribute in preventive healthcare services in accordance or in association with a doctor. You don't need to be a doctor. I'm there or somebody else is there. You can correlate, talk with your doctor. See, in your case, wellness programs, when you use these questionnaires in a corporate company, give the questionnaires will give you the scoring of anxiety and depression. How much percent is anxiety, how much percent is depressed. And body alignment, you can go and check it. Weight and height. With this, I can check, can tell the basal metabolic rate and what is your BMI, body mass index, and you can know who is more overweight, who is more less overweight, who is an alignment problem. So this is the kind of application I'm trying to see it to happen, so that you replace more of a doctor's
Metric.
Yeah, let's see. Mostly working around. You okay till this? Now I slow down and stop. Increased heart rate, increased blood pressure. Short term, no problem. Little long term, I may have a palpitation. Heartbeat increase. Suddenly I face some situations, my heartbeat. People will come to you like this, heartbeat increases. I'm not able to feel. I feel my legs are trembling. I feel I'm having sweaty hands. I feel very anxious. It is nothing but sympathetic overactivity. Perspiration. Sweating increases. Abnormal sweating. Moment I face a teacher, I feel sweaty, I feel anxious. Sympathetic activity. If it is short term, no problem. It balances. If it is long term, same high blood pressure will end up you in hypertension, disease. You with me? So this is how we can define indigestion problem. You are able to correlate blood supply to the stomach is less. Entire system. The movement of the food from the stomach and the small intestine, food will be absorbed, and in the large intestine, food will be waste products. Undigested food will come, and its water will be absorbed, and it will become semi-solid, and it will be thrown out. The movement of small intestine reduces if you are stressed.
Can you repeat again?
The movement of small intestine and large intestine reduces if your sympathetic activity is more. If you are stressed, you will have either constipation problem or you have some other issues of the stomach. Irritable bowel syndrome or constipation.
Peristaltic
What is
movement.
reduced? The timing, the food in the intestines
So,
The
reduced?
movement.
so Hadi, the ability
The
to
movement.
Ability, okay.
of colon.
Okay. The movement.
Peristaltic movement.
Peristaltic movement of the colon. Colon moves like this. So smooth muscles will push the food down. Here there is a contraction, lower side there is a relaxation. Some muscles contract and then they push the foot down. And here there is a relaxation. Again this contracts, this relaxes. Contracts, relaxes, contract, relaxes. It goes in the wave-like movement. We call it as a peristalsis. So that will be reduced and you will have problems of constipation. If I give you tablet to release the constipation, laxative, yes it is going to help, but it is not a permanent help. It is a symptomatic relief you are doing. You are with me? Okay. If the muscle tension is more, now I am coming to the point where you are sitting for a long time in your office work, your body posture is going to change the alignment. I was the most ugly hunchback person in my MBBS days because I used to read very heavy books. I used to read like hell and my neck would be bent down. Here in Sri Lanka you can see my shoulders. So I was trying to recover. more or less it's okay. So muscle tension will increase. If muscle tension is increased, muscles will go into a spasm. I take this as a muscle. Just you can see the muscles here. So these are all the muscles, and some of those muscles group will go into spasm because if they're holding too much tight for a long time. I want you to raise your hands like this. A few seconds you're holding, no problem. Your head, neck, muscles at the back. If it is, I take this spine, pelvis. Now I'm coming to your points. Keep holding the hand. Any pain? No pain? Soreness. So the sympathetic activity on the muscles will be more and muscles will go into soreness, and if I ask you to hold like this for hours together, that's what your back is doing. Your back is doing holding the weight of these muscles and spine for how many hours?
1 hour?
Many hours. Many hours. Drop your hands down. You feel pain? Sore? So if these simple muscles are getting sore in few minutes, maybe 1 minute, 20 seconds or some 2 minutes, think about your back muscles, because and gluteal muscles, back muscles and gluteal muscles are very strong muscles, so they don't go into spasm so early. Maybe at least 4 hours or 6 hours of continuous sitting will have a tendency of muscles getting spasm. Muscle spasm at the level of back and cause you back pain. Are you able to grasp me? Muscles getting sore at the level of shoulders, shoulder pain, neck pain. How many of you have headache, irritability? Headache.